future, hopefully brighter one. And thanks. My name is Mahdi Abdul Wahab. I work at KIT as a health system policy and governance advisor. I work here with all the colleagues, and I'm happy to have a great panel with us today. I'll just be introducing them soon. So we have here in person, and maybe everyone can just say one word. So Dr. Ibrahim.
Thanks so much, Dr. Mahdi. So my name is Ibrahim Barma. I'm a lecturer at Queen Margaret University, and my work is mainly on health systems in fragile and conflict-affected settings.
Hi, everyone. Once again, good to have you all here. I'm Ramin Ziwari, health economist with the World Bank, based in Washington, D.C., and working with the Middle East and North Africa region team of the bank and focusing mostly on Palestine. Just a quick note as well that one of my colleagues who we have worked quite a bit on this issue, Dr. Manon Hammerly, is also joining us virtually. She's also a health economist based in Cairo.
Hello, everyone. My name is Ilko Jacobs. I work here at KIT with Mahdi in our health system strengthening team, and I'm also chairing our Center for Health Systems in Fragile and Conflict-Affected Settings. Nice to have you all here.
Thanks. Hi, everyone. My name is Gaza Al-Jadba. I am the Chief Health Program on Orwa Gaza Field.
And we have also two online panelists, Dr. Ahmed. And Dr. Ali. Can you?
Yes, now we can unmute ourselves. So
Yes.
this is Dr. Ali Ardalan. I'm regional advisor and the head of health systems unit at WHO EMBRO, responsible for health systems recovery from emergencies and also humanitarian development peace nexus in the region, including Gaza. And very nice to be with you. And the photo that you put in the slide is my cousin. It's not me. It seems you found it
Thank
from
you.
on the internet.
I
Over to
used the one. I have to tell our communication team. Thank you. I used the, yeah, thanks.
Yeah. I am Dr. Ahmed Shatat. I am pediatrician. I am acting director of international corporation in Ministry of Health and director of planning. I am talking from Gaza.
Thank you and welcome everyone. So just to mention, the objective of this session is just to envision a future. We have talked a lot about the current situation, the history, and all the atrocities and tragedies, and the burden on the system, on the civilians, on all aspects. And the objective is, can we go to try to just look into how can we envision early recovery. Of course, for some people, it's not imaginable even to think about that with all what's happening now. However, as mentioned before, it's important to at least have in mind how this could look like and be ready to start running when it's time to run. We see in Olympics that just happens that you have to be ready the 1 second late running than others can make you lose a lot. So hopefully we can be ready when needed for recovery. And today, in order to do that, I was thinking about how we can design a session that allows us to do that. And I came up with using the future design workshop. I can, yeah, you can hear me? Yeah, so maybe on next slide first. So future design, maybe you are aware already of it. It is part of next also slide. It's a type of design workshop style, usually done in a whole day or even few days. I tried to do a simplified version of that and allow some open space for people to envision future and not analyze that, look into how it could look like, what are the obstacles for that, what are the opportunities for that and use the power of all the different people here, all the interest of people and enthusiasm to bring out such visions and discuss them together. So first we will start with a bit of background, so evidence. And here that's where why we have Dr. Ibrahim with us today. He would be presenting a short presentation about evidence from similar contexts and conflicts and early recovery stages and what is required. Then we would have a small presentation also from Dr. Ahmed about the needs and of the health system in Gaza. And based on that, we can start our actual group works. We will be divided into small groups, envisioning some futures. So hopefully we can be creative, but also thinking critically how we can make sure that this happens. For the evidence sharing, yeah. Yeah, if you feel like sharing, noting something, we have also our colleague Eloise here taking notes for the that would be shared after the conference. Yeah, so breakout rooms, I would explain that later. I have here summary sheets. So no worries about taking notes for the breakout. Every breakout room would have a summary sheet to make sure we are also documenting these ideas and even contacts of people who would like to work on that idea afterwards. We'll make sure of that. So just to not lose more time, I would like to welcome Dr. Ibrahim here to present his slides. Thank you.
Thank you so much, Mahdi. So yes, I'll yes, okay. I'll try not to shout, but I'll keep my voice at the level that it should be heard. So thanks so much again for this opportunity to speak about health system governance and financing for early recovery. If we go please to my slides. As I said, I have 10 minutes, so maybe that's why I decided to speak about the key strategic directions of health system governance and financing. So it's not going to be a long lecture, but really just highlighting some of the key messages that we would like to have with us while thinking about the specific situation in Gaza. If we go to the next slide, I just want to have some introductory remarks to say why it's very specific and challenging in conflict and fragile affected settings to speak about health system financing and governance. So, and I classified them under 3 categories. One is because, you know, the environment itself is very, very fragile. In a sense, you have, in addition to the instability and the political challenges to have a kind of a political solutions, there is always this risk of backsliding into violence. So, and current conflicts around the globe, we can clearly see that there is no end to these conflicts. So I'll give you examples from the region, northern Syria. Is it over or not? So, and then same in Palestine. Is it in comparison to the previous timeline? Is it, even if it's ended soon, is it the last one or not? So, and Lebanon, for instance, even after 2 and 3 decades of some kind of stability, are the environment is less fragile or not? So, and also at governance level, you have challenges at leadership, you have weakened state institutions. So most of these countries go out of the conflict itself with damaged infrastructure, weakened social services, and so on and so forth. You have disrupted economies. Their fiscal capacities are very low, and they would rely on external assistance and inconsistent funding scheme for a long time. So now if you would like to, please, can we go to the next slide, please? So if we would like to just highlight the principles of health financing reforms, and we have some evidence from international experiences that we have some guidelines how to move forward with it, and they are somehow similar in terms of function. They are similar to, I would call them quote unquote stable settings, because COVID-19 also showed us that there's no setting that is stable forever. So we need to think about how to raise revenues in a sustainable way and relying mainly on as much as possible on local domestic sources of funding, then to pool them, reduce fragmentation in the multiple funding schemes, move towards strategic purchasing, and also defining the entitlement or the benefits that the communities would need to have in order to meet all the goals of universal health coverage and a good financing system that I don't have the time to detail now. So if we try to take each one of these four functions, and in the next slide, I'll start by talking about revenue raising mechanisms. So as I mentioned, they are constrained by low domestic income and high reliance on funders. But again, I'm not sending the message that from day one, there shouldn't be reliance on international donors, because as we know, there should be a commitment by donors, at least in the, depending on the setting, for the first few years to engage into supporting the system. The example that I would like to give is from Afghanistan, where a specific trust fund managed to pool funds from international donors, and it was able to cover about 50% of the national healthcare expenditure, especially in those first few years where you have the taxation system is eroded and usually government budgets are unstable. And of course, in Gaza, it's a different situation where even taxation is channeled differently and you have different challenges in terms of accessing to the budget of the government itself. Now, in terms of pooling, what would be the key recommendation from elsewhere is really to try to channel all these domestic humanitarian donor incomes through one channel, and even starting with a small amount. Sorry, I'm on the next slide. I'm really sorry not to mention that. And there are examples. So for instance, from Cambodia, you have this health equity fund. It was, and just also to highlight, because I'm supposed to touch upon governance and political economy as well, that these funds can start be funded by NGOs and external donor, especially in settings where you don't have really a clarity on the political scenario or what's going on at the political level, and then move toward government ownership, and I would add stewardship as well, which kind of help us, I would say, merge the early recovery needs and responses to the long-term sustainability. And this example, as I said, it managed to serve about 2 million of Cambodia's people. If we move quickly to the third function of health systems financing, and by the way, all these are based on this document that's available online and written by a lot of colleagues that we know, Dr. Mataria, Dr. Bertoni, Dr. Witter, Dr. Andrians, and other colleagues. So in terms of purchasing, I know it's maybe sometimes it's very, very early to discuss strategic financing and then moving from input-based financing to strategic. But even with these early recovery projects, especially from the World Bank, there are ways to introduce pay for performance modalities. So in a sense, start introducing incentives for better and affordable and, sorry, I would say better quality of services, just not to go into the details of pay for performance modalities. And of course, all these mechanisms should be integrated. And the problem in many conflict and affected, fragile and conflict affected settings, that also we have different entitlement for different populations. So in places where you have refugees as well, these categories might not having the same entitlement as local communities. And there is a kind of a principle also to move forward with trying to have the same entitlement or kind of integrating purchasing mechanisms for all of them to avoid fragmentation. So if we now go to the next slide, it's about quickly some of the co-payment arrangement that can happen in health for health financing in post-conflict or fragile and conflict-affected settings. So I would bring in the cash and voucher assistance that was used in many settings, including in our region in Syria and Yemen. And maybe specifically, I would say for voucher assistance, which shows maybe a better kind of linkages with access and reducing challenges of access to care in comparison with cash assistance. But we need to keep in mind that these solutions or interventions are not kind of available without logistical and security related challenges, as I said, because even in, I'm not going into a conflict analysis, but even in most of these settings, you don't have the same accessibility to all territories within the same country or the same region. If we now go quickly to highlight some of the governance and political economy challenges, and I hope I wouldn't take more than 2-3 minutes on these points. It's just to highlight that from a political economy perspective, the main challenge in conflict and in crisis affected settings is this imbalance in power between the internal actors and the external actors. And this would lead, as we all know, to a kind of a poor level of contextualized policies. So that's why I really highlighted, especially maybe for the role, specifically for the discussion later, that there is a role for policy entrepreneurs, so even non-state actors in these settings, to push the agenda forwards. And again, we would like, I'm sorry to say, there is a window of opportunity. No one would like such an opportunity, of course, especially in the settings in this setting that we are discussing. But sometimes there are some opportunities to move forwards with some strategic and I would say structural reform in the health system. If we go to the next slide, to now go into a bit of a practical, and I think I don't need to repeat these. We all heard them in the morning sessions as well. So we need to kind of have a better governance, specifically in terms of accountability and more transparency, to be able to reduce inefficiencies in resource allocation and the trust in public institutions. And even for some of the health financing function, it would be better to improve the management at facility level. So public function, the financial management, also there are a set of interventions to improve that. And now if we go to my last slide, is just also highlighting some key points about the inclusiveness of governance. So in a sense, we need local leadership in those settings, involving local communities and authorities in decision-making to ensure that health financing decisions are relevant and sustainable, to strengthen local governance by strengthening health institutions themselves, public health institutions, like policy making include capacity for people to make policies. So you need to strengthen these. And in the last point, I said just where feasible, because decentralization is something very important to build a resilient health system. And I'll speak about the word resilience because we had a lot of thinking about it. But when it's possible, it would be interesting to decentralize, but with a lot of coordination, because sometimes if you decentralize without supporting local facilities and communities, you would maybe doing unintended consequence of reducing access and quality of care. So that's, I think, my presentation, if I'm not mistaken. And thank you so much for listening to me.
So thanks, Dr. Ibrahim, for setting the scene and just giving us background. Unfortunately, the world has a lot of experiences with conflicts and resilience and recovery, and hopefully we can learn from that. Now we have another presentation from Dr. Ahmed Shattat, who would be presenting about the needs of the health system in Gaza. Yeah, to ask him to unmute, I guess.
Yeah.
Yeah,
Hi,
Dr. Ahmed,
everyone.
we hear you
Thank
well.
you. Yeah. You hear me? You hear me, yeah?
Yes.
Yes. Okay. Good evening for everyone. Thank you for this opportunity to present about the situation and about our needs regarding of the governance aspect and finance aspect. This is the beginning. This is the Gaza before the war, but now it is different, unfortunately, including of all of our healthcare facilities, including hospital and primary healthcare center. All of these buildings are destruction. Next, please. Next, please. Regarding of governance body which presented before the war, I want to focusing about the governance body which lead of the Ministry of Health and health sector of health in Gaza during before the war. We have good hierarchy body and strategic operational plan every 5 years, and good national health information system and analyzing decision system and guidelines, and all of the guidelines regarding of equality, and also Palestinian Medical Council. And we have board for consultancy body which supported MOH and health sector with consultation relevant for different issues for the health. This is before the war. Next, please. Regarding of the health indicators, let me to focusing urgently about the health indicator, which was achieved before the war, and this is very good comparatively to other country around of the Palestine. Regarding of maternal and neonatal and infant. Next, please. This is Shifa Hospital, but now we are talking about this situation which we are living now. You know that about the situation, destruction, all of the health facility in the north, and most of the services in the south. And this is Shifa Hospital. This is a small example regarding of what we are waiting and how we can continue and provide service for our people. Next, please.
Dr. Ahmed, are you there? Yeah, it must be. We have the
Yeah, excuse me.
Yeah, welcome back.
Are you hearing me?
Yeah, we can hear you.
Yeah, please. Next, please. Okay, the situation now is known for everyone regarding of limited access, destroyed everything, stuffing, targeting of supplies, shortage of supplies, everything. Now we are talking about the situation which we are living now regarding of how to provide and continue to provide the basic service for our people in this situation during the war, and also about how we can continue to provide this service after ceasefire. Next, please. Next, please. Okay, regarding of our vision about before the war also, we have national regional master plan. We can base of this national master plan to continue our vision to restart, to rebuild our healthcare facility. We have a clear service package, which we are hope to reach. This is before the war, and the minimal service package which we need now, and regarding of the map and level of the map services according. Next, please. According of this vision, this is vision not only the last few years, but also this is vision continue to reach attaining a healthy Palestinian community enjoying advanced quality, comprehensive, independent, and sustainable healthcare. And we hope that this is big vision. Next, please. This is return concept. Next. Yes. This is very important slide to discuss about the situation in the 0 stage and first stage and second stage and third stage. This is a conceptual framework where we are focusing in the 0 stage, which we are living now in response, and how to continue to provide and to achieve and to reach the basic service for our people during the war. And we are focusing about more than 14 direction, and this is the stage we are nominated as resuscitation stage. After ceasefire, we looking that there is first stage and second stage and third stage, but also in this stage, 0 stage, which we are living in this, which we are displaced, which we are continue fighting to provide all of the service, which we are facing with all the challenges now, and no stability, and most of 90% of our people are displaced. We are thinking about the day after ceasefire, how we are thinking, and we must be running some of strategic thinking about that, so that in this stage, a first stage, which continue after ceasefire and before ceasefire, to ensure providing best service package according to rapid need assessment for service package, urgent and short rehabilitation for healthcare facility, deep assessment. This is also must be initiated, and we also initiated some of assessment now during the war for most of our facility and most of our healthcare hospital and bed capacity. Also about maturation in this stage must be maturated of this vision of healthcare system, which we reach according to rebuilding stage. So that this is a stage as a refunctioning stage. We're talking about then second stage, which we hope to reach in this stage to rehab and compensate all of the which we destructed, which the Israel destructed before the war. And the third stage, comprehensive and reconstruction and reform, and according to come back to our system more better than what was previous. Next, please. Assessment, so that it is important about the assessment, and we are talking about the assessment in the level of rapid assessment and in a deep assessment, but now also in the zero stage, we run some of assessment, rapid assessment for rehabilitation, some of building, which is needed for continue providing of some services now, according to economic visibility and time visibility. In order, this is assessment in defining urgent intervention plan and utilization of available resources. You know that we are now in very bad situation regarding of the siege and according of the limited of resources, and prevent duplication and fragmentation of effort and guiding donor in zero and first stage. Next, please. Okay, regarding of this early recovery, the situation is very sensitive regarding of all determinants, health and social and economic and environmental determinant must be focusing during this stage. Next, please. Next, financing. Regarding of the financing, we hope that urgent emergency funding to restore essential services for short-term priority, including of medical supplies, pay for health worker, operational control, and urgent sum of rehabilitation for some facilities. In this urgent recovery or early recovery stage, this is must be focusing about this is for things to achieve to provide the basic service for our people in the next day of ceasefire. Next, please. Next. Okay, regarding of the governance, it is important to centralize coordination, as my colleague previous are talked, develop a detailed plan, and we have now going for some of not the deal, but the main direction of this plan. For strategic alliance and advocacy initiative must be policy and leadership development, transparency and accountability, and maximize synergies among differently. A long term, next please. Next. Long term, okay, let this start. National government body which must be lead and supervise the restart, rebuilding, restoring of stage. With support of, we hoping and we are looking with support of international partners, including of UN agencies, WHO, World Bank, international and Arab friends and expert, high committee to lead of this is stage, member from Ministry of Health, WHO, UNRWA, PRCAC, NGOs, international NGOs and national NGOs, national and international experts. This committee must be able to develop a plan for rapid assessment in order to short-term intervention, develop a plan for deep assessment and able to good understanding of complicated context, identifying gaps, utilization of resources, developing vision for health system, endorsement standards, endorse a plan and supervise implementing a plan. Our context is very complicated, not similar Gaza, any example in the world. We are in the siege, no available of resources, limited donation. Everything is very complicated, so that I think to understand of the complicated context is very important to achieve and maximize of efficiency of resources. Next, please. This is what hope with this from this committee able to analyze to vision to strategy and controlling. Next, please. This is I am sorry to focus about this is from our experience in this war. I think that occupation many times talk that Palestinian able to establish on a state, and others unfortunately say that Palestine couldn't coordinate and plan, and unfortunately before the war we as Palestinian in Gaza and in West Bank, able to lead and to coordinate and governate many of this. And I think that World Bank and WHO witnessed about our weakness, our experience during many times and according to our health indicators. But unfortunately, let me to inform that during this war, many of international organizations evacuated from the north of the Gaza, and people and Palestinian who is okay. Also about poor coordination, fragmentation, duplication, poor understanding of context, all field hospital dependent. Also, some of poor examples for donors. This is field hospital, which is unfortunately still, this is field hospital which is established in Gaza, are dependent to MOH and need more governance body to coordinate this donor effort. Next, please.
Dr. Ahmed, we are running out of time. Can we shorten it to 1 minute?
Okay. This is
Thank you.
Okay, thank you. This is the last regarding of the threats, continue of the siege, instability of political system, continue genocide and military operation, and until now we didn't know when this ceasefire is happening, lack of sustainability of funding and resilience on grants and aids, massive destruction of healthcare services infrastructure, fragmented pathway for rebuilding and different agendas, weak non-national governance body. This is a threat could be affected all of the outcome of the rebuilding stage. Opportunity, we have good desire and spirit of challenge among the health system workers. Also desire of international organization to contribute to the restoration of health system, having necessary experience identifying needs, existence of significant previous effort in the health system governance. And next, please, next, we will rebuild, of course, and thank you again for this this opportunity to present about the situation in Gaza, and we continue to survive and continue to support our people. Thank you again.
Thank you. Thanks. We had now I hope that everyone we are on the same page. We have a little bit background on what it requires to recovery, what is needed on ground, and now maybe we are a bit active to work together on the group works. If we go to the group work. So the idea of the future workshop is to come together and decide on visions and analyze those visions, or do some critique about, if you click next, looking into what is the vision, what should be done in order to do that, who are the actors or stakeholders for such action or vision, what are the obstacles, and also, of course, what are the enablers and drivers, or what is needed to have it in place. We have identified 4 topics, and they were based on discussions, and maybe you realized them already. They have come more and more in discussions today. Of course, first one is national coordination body. It was proposed by almost all the and all the presentations that we hear today. How this could look like is up to the groups who will work on that today. If you are interested, you can just join. We would distribute the groups in the room, and also there would be one group online. The cooperation and preventing the fragmentation. So making sure that we are working together, preventing the fragmentation and working in silos or redoing and preventing inefficiencies in that. How to measure and quantify the needs. It was also mentioned many times how inaccurate many of the measurements that have been done, and in order to reach recovery, we need to make sure that we know what exactly is needed. Then fourth topic is about how can it be different this time? What is your vision? What should be done differently? That this is open to in future design. They even call it the fantasy session, where you can just dream. We try to make it a bit of structured dreams. So we have here those sheets for the working groups. So just to make sure that, of course, we have ideas, but we need also to see how they could be practical ideas. So looking into each of them, of course, according to all the 4 elements here. We would have 20 minutes, and I tried to see how we can make sure that we keep that time. And we have a video here of countdown of 20 minutes that would be taking all the time. So I would remind you when it is coming to an end. I would I would suggest that, because actually we are more than expected in the session originally, but we will keep 4 groups in the room and 1 group will be online. So we would repeat the group number 1, because it was originally meant to be on the online. There would also be another group number 1 here in the room. So group number 1 would be this part of the room. We would just reshape the online. No, this would be also in person. So the online would be having their own group. I would join them now with my colleague.
So where we will sit?
Yeah, you will sit just here. You will take this space. Group number 2 would be on the this corner of the room. Group number 3 would be in this corner of the group of the room, and group number 4 would be in this corner of the room. Yeah, please join the group that you're interested in, and I'm coming to each group also to explain. So group 2 is in that corner. Yeah. And I'm coming to the group to explain also how it works. Yeah, I'm coming to explain to.
Yeah, shall I take one of these?
Yeah. Even if there are more ideas within the group,
You can take one of them.
yeah, if there are more ideas within the group, you can use even more forms, because try to make each one for one. Right? I'm here. Yeah, if you can join one of the. I'm here to help you. That's great. No, just join one of the groups and help with taking notes if needed. Yeah. Yeah. And I'm coming. Do you want to join? I'm not sure how we can make it online and in person.
Yeah, the co-host would have to join if they would like to. This computer could join as a co-host.
Yeah, and then you can listen from this computer, but then we will have to be very close, sitting very close by the computer.
Let me move out the way and let me join.
Yeah, join and maybe open the audio.
Yeah.
So.
They are online, huh?
Yeah, there are already a group online. Dr. Ali, do you hear us? Dr. Ali, do you hear us? And Dr. Ahmed, do you hear us?
We're just setting up in the room.
Maybe if you go outside the room.
Yeah, can we do it outside the room, Mahari?
Maybe by the
We may move the computer to outside the room.
Just too noisy here.
For this.
Yeah.
Okay. They see now, but I'm wondering if we move to
Maybe noisy here.
yeah.
You can't hear the computer.
If I ask you to go into the marble hall, then I can bring
Tell us where is the marble.
yeah. Okay.
So we need to go outside.
Yeah.
One, in order to join people online. Something important. Public funding in the program, this keeps being your vision. Not waiting until It's international debate now. It's on the next day after the ceasefire.
Yeah.
We have the years, so I guess they're not professional negotiators do that for years. Yeah, so what I brought here shall we go back and push into the that we have time to
Professional negotiators have been trying to do for many years, right? So we all know that. So I'm happy that with whatever we came up with, at least some ideas in our only 20 minutes, which are very limited. Now we go back to the last part of our session. We have a panel here of our panelists and also Dr. Ahmed and Dr. Ali who are joining us online. I hope that they can hear us well. Yeah. Hello. This Dr. Ahmed and Dr. Ali. Do you hear us? Yeah, they can't say anything because they have to be unmuted. If you ask them to unmute, so they can join also this discussion.
Yeah, thank you. I hear you.
Thank you.
Now.
Great. And we can also put Dr. Ali. Then I'm introducing my colleague here, Elko, who would be running and moderating the panel discussion. And also we would be wrapping up the conversations afterwards. Thank you.
Thank you, Mehdi. And hello, everyone, again. It sounded like we really interrupted or like prematurely stopped some very interesting discussions here in the room. Sorry about that. But this is also an opportunity to hear back a bit about what you've discussed, mixed with, of course, I'm going to invite some reflections from our guests and speakers here, their own experience on some of the themes that you've discussed and more broadly about recovery, if hopefully that will come soon, if that will come to Gaza. So first of all, I'd like to start with you, Dr. Gada. What would you think about, like, what is important to keep in mind when trying to ensure coordination and prevent this fragmentation that's often seen in fragile and conflict affected settings, emerging from conflict or crisis, or even during crisis? And we've heard earlier from Dr. Bouhoum about the importance of trying to mitigate that, to ensure coordination, to align better, to harmonize efforts? What would you say came out of your discussions and your personal experience for UNRWA in doing so?
Thank you. In fact, since the start of the war, this was the main priority to our work. Like, we cannot work alone with this huge mass destruction and increasing huge needs at all. And I was discussing with my colleagues in this really wonderful group, and really I wonder why we are not doing such a group discussion in the health cluster. Like, it was really amazing. Like, but a little bit after a while from the war, I personally felt that, and really this was mentioned in different sessions today. I personally felt there was a competition between different health providers or partners. And for me, as like a Gazan, and also a manager in main organization in Gaza, I didn't feel good about that, because it is not about competing between humanitarian organizations. The humanitarian organizations, they are found to provide the humanitarian support to the vulnerable people in very fragile situation. So it is not about that, yeah, UNRWA is the best organization doing. No, it is not about that. It is about focusing on the people on the ground who are in bad need of those humanitarian organizations. So to avoid that, and even before how we can mitigate or avoid that, even on the ground, we found that like this organization is doing the same thing we are doing in Gaza, and another organization, they are doing something the other organizations, they are already doing. So it is a kind of mess. So what we need to mitigate this, and in order to effectively and efficiently utilize the very minimum resources provided to those vulnerable people in Gaza, is to have this, what we agreed in our group discussion and what we believe, that to have this unified platform to consolidate all of the efforts, and also from different partners, and also to consolidate or to make one platform for the funding opportunities. And this is very important. And this can, and by this way, maybe this will be the health cluster. The health cluster, it is available body in Gaza now, and in Palestine now it is available. So we need to empower the rule and building on the available health cluster system, but we need to empower that. By the way, health cluster is called by the Ministry of Health, and all of the work of the partners should be under the umbrella of the Ministry of Health. And I know that the Ministry of Health had even interventions to ask all of the working bodies on the ground to like notify what they are doing, and this is important. So the work should be under the umbrella of the Ministry of Health, but the health cluster will be the unified body which can coordinate and mitigate any fragmentation or duplication of the services on the ground.
Thank you so much. Yeah, no, great you emphasize the work of the health cluster there. I'm also wondering there, you mentioned funding for the system, and we heard of some interesting examples from other settings earlier. Could I invite Dr. Ali? Could you say something about what modalities we can think about for health systems financing during the recovery phase in Gaza, if that moment comes? What do you know from other settings? Also bridging the humanitarian development nexus. What could work? What could be feasible, and how could that be tied also to local systems?
No, thank you. And actually, it's a very important question. And the fact is that even the cessation of the hostility and any ceasefire, hopefully very soon, the level of the humanitarian needs will remain high. So in that sense, the first thing that we should emphasize is that continuation of the humanitarian fund from any sources. However, it should be well coordinated. And there are examples actually of the pooling of the humanitarian funds, and now with the solid coordination that the cluster is leading, and that's glad that also Ministry of Health is co-leading. I think that should be continued. However, at the like moving toward the early recovery process, from the other side, also we need to think about establishing a strong coordination mechanism. However, it would depend on the political governance and the lines of the ceasefire at the end, the relation between PA, the health authorities in Gaza, etc. But as an assumption is that whatever we do should be integrated into the basically national strategies and plans and led by the Palestinians. And just getting back to the humanitarian funding, for sure the country needs cash and voucher assistance to support the current situation, and for some time the health needs of the people. In a longer run, basically we need to mobilize the resources, and now we have the World Bank strongly present in Gaza, and we work closely with them to develop the health sector strategy. And that's an excellent opportunity to mobilize all the funding sources to support the health sector strategy under one framework. Over to you.
Thank you, Dr. Ali. Thank you for also mentioning the importance of aligning financing and governance efforts to national strategies, or at least local needs that are locally defined and appropriately assessed. And that's also a bit of a bridge to Dr. Amin here, who I'd like to ask how in this extremely challenging situation does one appropriately assess those needs and also prioritize what needs to address first, or in what sequence? What can you say about that? What came out of your group, and what's your experience on this from other settings?
Yeah, thank you very much. So on this key question, actually, thanks a lot for colleagues for incorporating it as one of the questions, because we at the bank, as mentioned in the presentation in the morning, we are trying to conduct a rapid damage and need assessment. And then, of course, we did previously an interim damage assessment, where we try to look and quantify what are some of the costs associated with all from the conflict itself that is coming, and also what, more importantly, what are the real needs in the ground, right? So while we do have a specific methodology in place and has been conducted in joint collaboration with the UN agencies and previous setups, we do see some caveats in it. And to be honest, as a health economist myself and colleagues who are joining the call virtually, we do feel that there is a lot of room for improvement. Just a small example to it, for example, when we did the interim damage assessment, the way it happened was like, we worked with different entities who had access to satellite data, and then we looked into what is the damage that has happened in terms of like infrastructure. And then, of course, we try to quantify and do estimation of within that infrastructure how much medical equipment and needs could have been, and then that damage of it, how much it costs, right? But then, of course, we do miss on a lot of important aspects, like, for example, the loss that's associated with each of the health workers' life or injuries that happens, right? How much it's going to cost to just retain that and gain that back, or the health information system that goes with it. Or then again, in terms of like what is specific need, because that damage is basically, if we are trying to go back to where Gaza was, that damage basically quantification makes more sense. But if you want to see what exactly is the need, that's where it gets tricky, right? So we did had a good conversation. I did took some comprehensive notes that I would be happy to share after the session as well with colleagues. But some great ideas came that in terms of at least on the infrastructure, it was great to hear that there are different agencies in the ground, like Arab Association of Engineers, I believe, and all other colleagues who are already trying to do some of that work, and also colleagues in WHO were mentioning that how they did specifically in terms of like seeing one specific tertiary healthcare facility and how they did it in all terms of like not just that reconstruction, but also in terms of like what's it gonna take to functionalize the facility. In terms of the need itself, I just want to give a quick example. Yesterday, I think a couple of days ago, WHO's report came out on what's the cost of the injuries that has happened, right? How much it's going to cost. We all keep hearing the numbers like 90,000 people have been injured, right? But when we look into the actual cost, how much it's going to cost to treat them, we need to go back into the details of how many injuries one patient has, right? There were cases of like more than 5, 6 different type of injuries, each requiring complicated surgeries. So it's going to be critical to understand that not just overall what is the damage, even in terms of like the burden of disease itself, but also how much. So it's very difficult. Key challenges is always going to be data access, especially in the current circumstances. So probably what at least I got from the conversation, we can try our best to work closely with the institutions and the ground agencies, especially local ones who are actually working quite specifically and targeted. But at the end of the day, we'll have to rely up quite a bit on some of the estimations as well. Because again, we cannot wait to have very accurate, detailed costing of what is the need before we can start working. So yeah.
Thank you very much. Yeah, no, very interesting to hear of the different methods you can use, you have to use in such a setting. Of course, for the longer term, hopefully health management information systems can be established and strengthened again. You mentioned that. And on that topic, I'd like to invite Dr. Shatat also to hear from you a bit of how do you see that, the possibility, the potential of developing that again? How much of a priority is that for you? And if not, how else do you feel you can get a bit of a grip on the needs, on the utilization, and like where to prioritize support through your own systems? I hope I am making myself clear enough, but do let me know if you'd like me to rephrase. Dr. Shatat, yeah.
Okay, thank you. I understand from your talk that how we can identify our priority and needs now in this phase, yeah?
Yes, and also maybe the role of your health management information system in that, and local systems, bring them up to speed again in trying to get a grip on the situation. Also, just more sort of the needs and the information that you need to take decisions.
Yeah, thank you. Yes, of course. Without information, we couldn't do any plan. So that in spite of what happening of destruction of all of our health information system, this was in November 2023, and we have before the war good health information system, but now since two months we restart partially centralized health information system, our health information system, but we facing many challenges of that regarding of availability of resources, which distracted from Israel side. But we try to compensate and to fill the gap so that in the level of the information, which is dependent of the assessment of infrastructure destruction, we have now enough vision about the amount of the destruction of the buildings, which buildings and which amount of the rehab of this hospitals and facility. And also we started some rehabilitation for some of our building, which is not need huge resources, not according to availability resources also because this is urgent to restart this facility. For example, in Shifa Hospital, all of the Shifa Hospital are distracted, and we couldn't provide service in Shifa Hospital. But according to the need of the people, we have to establish and restart some of service in Shifa Hospital so that we reallocate the emergency department from emergency department, which is need huge big rehabilitation, and we couldn't find resources for that. We shifted the emergency department to the outpatient clinic, which we rehab. Did the urgent rehab and restarted this service, so that our priority will be based according of the urgent basic services which we have to provide for our people according to the minimal standard and according of the map of distribution of our people, which is now not fixed. You know that this is also other challenge now in this phase. But if ceasefire happening, all of the displaced people will come back to their towns. For example, I am displaced from Gaza and I am living in Khan Yunis Governorate, and hope in spite of destruction of my home, I will come back to my home and will put my tent beside my home. That's mean that most of the people come back, so that this is also another responsibility for much to with partners and UNRWA to find the basic service for these people when they are coming, so that our vision now how to continue the basic service for all of our people in all of the level, I mean level primary healthcare and secondary healthcare. What about tertiary? I think that we trying, but it is not easy according to the siege, and Israel forces reject to pass anything regarding of tertiary services and part of secondary service.
Thank you, Dr. Shatat. It is, yeah, despite the crisis, it's quite hopeful what you're describing about restarting services at Al Shifa Hospital. How, you know, despite all that, in the very challenging circumstances, there's still efforts and hopeful signs that it is possible to provide services. And also just on that, I think soon we need to wrap up a little bit. But I'd like to also just ask Dr. Gaza, what lessons do you draw, maybe briefly, on the recent polio vaccination campaign that was just rolled out very quickly, very swiftly, very efficiently, by the looks of it? Can you say a little bit about how that was done? So, you know, and what lessons can be drawn from it for other type of response efforts? Yeah.
Thank you. This is very good example in specific how we can talk about the challenges, the difficulties, and do you know the sufferings of the health workers and the managers in order to make any intervention on the ground in Gaza. Any intervention or any even health services provided in Gaza, it is not only achievement, it is like making miracles, really. Like I suffer from that every day. Like when there was decided to have this polio campaign in Gaza, and there was like establishment directly of a steering committee and a technical committee, and they were led by Ministry of Health and WHO, and UNRWA is the main partner for sure, because we provide in the regular time about 70% of the vaccination to the children in Gaza. So we were major part. So it was in very short, it should be in very short time in order to mitigate the risk of widespread of this virus among the children. After confirming one case, not only like having the specimens in the sewage, but after confirming one case of having poliomyelitis, so there was like very rapid action to conduct the campaign. It is not easy at all. Like it is not easy at all for UNRWA to recruit 1,000 additional health workers in order to participate in the campaign in only 2 days. Like in the first, there was a decision to have the campaign in 7 days plus 1. And then the Israeli side decided no, because there was huge advocacy to have like a humanitarian pause during the times of the campaign. So they decided to have it only for 3 days. So in this time, we needed to duplicate the number of the staff in 2 days. So it was like impossible. And you can imagine how much it was very stressful to us in order to communicate the people. You know, we have roster, we have the roster, we have information about all of the candidates, but everything destroyed. The people die, like they are not in their places and they lost their phones, and so it is not even difficult. Sometimes it is even impossible to contact people. So it was like we don't know if we will succeed or not, but thanks God we succeeded to contact. Like maybe we contacted 5,000 of candidates in order to secure 1,000 of candidates in 2 days only, and then to train them with the support of WHO and UNICEF, and to form the teams, and to take from our staff, from the working staff, to be team supervisors, to supervise the vaccinators and other, to ensure the quality of services, because it is not easy, it is critical, and to conduct all of these issues within days. It was like a miracle, but we succeeded to do that with the working staff on the ground. They worked 24 hours a day. Really, we were working without we couldn't sleep until we succeeded to form the teams. For sure, WHO technical support, UNICEF technical support, and all of the logistic support. Thanks to all of them. A huge thanks to all of them. So they provided all of the logistic support for the campaign, and you cannot imagine the details. Like I don't have time to talk about the details, but really it was like making a miracle, and we succeeded to do that. And at the last time, there was vaccination of more than 530,000 children, coverage 87% of the children, the entitled children, which is amazing in this situation. And by the way, during the vaccination campaign itself, or the polio vaccination campaign, there was also displacement. There were order of evacuation and displacement of the staff and of the people, and we succeeded to do that and to vaccinate this number of children, and the remaining fixed structure health centers just to provide the remaining children of the vaccines. By the way, sorry, I had a video, but there is no, they sent to me yesterday, the responsible person in Onorwa, they in Gaza city, where the huge destruction, where like Gaza, when our director, Dr. Sita Akahiro, visited Gaza city itself, he mentioned to me, it is like the end of the world. And one of my colleagues, he sent to me a video. They make it like they made it for the activities, and when they are vaccinated, the children, they were drawing like beautiful things there, like flowers, or like a heart, or their names to the children, and the children, they are happy, the vaccinators, they are happy, and they are making this video. I didn't know like if I need to be happy or sad when I seeing that. Thank you.
Thank you. Yes. Thank you. No, indeed, very impressive and very important work. Thank you for taking us through that. Maybe lastly, really, we need to conclude, but I'd like to also just hear from Dr. Boorm. Just a very big question: what could be different this time, right? That's the question you try to grapple with in your group, but also just based on what you've seen in other settings, what to not repeat, what lessons to draw from it, what mistakes not to repeat, and maybe what also we can learn from recent efforts. Could you say a little bit about that?
Thanks. Again, I think I'll start with the example of polio. You know, I mean, this is a very good example because local actors, they have the knowledge. So they didn't have the capacities for a lot of months now, like just over maybe 10 months. But then when they have the capacity, they have the knowledge. I think the key message for this specific settings and from other settings is leave it to locals to do it. Because I mean, I was, while I'm hearing colleagues speaking, I had listed, and because also I had to work with WHO on the World, and then later the World Bank on the recovery plan. I'll just want to list what they have before the war. So they used to have a strong surveillance system, a good central lab, the UNRWA response to COVID-19, not just the health, but the social services. They have a committee to accept donation, to review donations, like supported by WHO. The PHC system is strong, you know, like they have all these things. So I think the key message is like not to create new things. There are things that they are there already, and just work with them and like work through them. And I think from my group, there was a very key point highlighted. I think there is another thing to close with, maybe this session, is to be able also for international actors to support local actors, because there is a lot of obstacles for them to be able to channel money or to support local NGOs. So I think there is an advocacy at global stage that should happen to be able to enable change. And I think, again, I don't want to spend, we know we need to close very, very shortly, but again, my key message is like they don't have the capacity, they have the know-how, they have decades of running the health system, and we need to rely on them.
Thank you very much. Now, important key message, and I think it's good to close with that. Bit of hope also. Thank you so much. Also, Dr. Shutta, Dr. Ali, for your contributions. We'll have to really wrap up, so I'll give the floor to Mahdi for any last words.
Thank you. Thanks for our panel. Thanks for everyone. And just maybe to end up with a quote from Desmond Tutu about hope. And he says, start of quote, hope is being able to see light despite all of the darkness. And I'm happy with all the discussions we had today and being able to at least see some hope and see some light, and wish that this can be true as soon as possible. By this, I hope that now we are already a bit late. We started a bit late. We are on time with our session. We just started late. So that's with that. Thanks everyone for your active participation. And please, we are going back again to the plenary sessions. There is still the break. Next session will start in 20 minutes, I believe. Just an announcement that we will be emptying the room here to be used for prayers. There are no more sessions in the room anymore, so just if you have any belongings in the room, you will need to evacuate it. Otherwise, thanks a lot, and let's keep the conversation going. Yeah, thank you. Just